Hello, I'm Dr. Sundari Mace, Sonoma County's health officer, and I'm here to share the latest updates on coronavirus in Sonoma County. First of all, I'd like to acknowledge that today marks the first day of National Nurses Week, and I'd really like to express my deep appreciation for the role that nurses play in delivering all the care for patients who are suffering from COVID-19. COVID-19 brings into sharp relief how they put their lives in line for all of us. So thank you to all of the nurses that are working so hard for COVID-19 patients. I'd like to give a big shout out to the Sonoma County public health nurses, particularly, who are on the front lines doing all of the intensive contact tracing, case interviewing, contact interviewing, isolation and quarantine. They are really the face of Sonoma County's public health efforts. So thank you, you rock. So for my general update today, as of May 6th, there are 272 confirmed cases, up 11 in the last 24 hours. Of these cases, 141 are active, 128 have recovered, and we have the 3 deaths that we have reported since last week. There have been 7,931 coronavirus tests completed, and we're up 1,280 tests in the last 24 hours. You might be wondering why we're up so many tests. So really, to explain that, over the past 10 days, we've significantly increased our testing by about an average of 200 tests per day for high-risk groups. As you've been hearing, we've been testing healthcare workers and first responders. And now we're sending the samples for these high-risk groups to UCSF laboratory for testing, and UCSF then sends the results back to Sonoma County. We just received the first few days of test results, and now we anticipate we'll receive new results from UCSF regularly. But as a result, the test results kind of all arrive together, which is why it seems like we have such a big increase in tests in one 24-hour period. We also, of course, have the new testing platform from the state of California that we've been discussing in Santa Rosa and Petaluma, and that's adding another 260 tests per day for the whole community. So today, I really want to talk a little bit more about the state-run testing and give updates on the county-run testing as well. So our 2 new testing sites opened yesterday, one in Petaluma and one in Santa Rosa. They're operated by OptumServe, which is under contract by the state of California. And I'm very happy to say that the state is providing these testing sites because community-wide testing is a critical step towards opening the county. And it does allow us to identify and increase our understanding of COVID-19 community spread. As I've said before, I don't think we have a lot of community spread, but this is going to really help us to determine how many people in the community might have potentially been infected. So each of these OptumServe sites serve 130 persons per day. Anyone can make an appointment by going to the website lhi.care/COVID testing. And people without internet access can call 1-888-634-1123. At this time, people who speak a language other than English should call for an appointment and will be connected with an interpreter. So please do call 1-888-634-1123 for an appointment, or visit our website, socoemergency.org, for information on how to get an appointment. Because of the high level of community interest in testing that's been offered through OptumServe, appointments are filling up very quickly. But OptumServe is actually working to open new appointment slots, and we are going to be adding more lanes and capacity to these sites by next week. So just stay tuned. Thank you for your patience and willingness to participate in this important step in reopening the county. We'll announce when we actually have additional testing available at OptumServe. There is no cost for the test for those who don't have health insurance, and no one's going to get a bill after getting tested. These new testing sites are a separate operation from the county drive-through testing that's happening at the Sonoma County Public Health Laboratory. Now, we originally started testing healthcare workers at the county site, but this week we are expanding to other high-risk groups. So the county testing site is now open to 4 groups of high-risk individuals. We're still testing healthcare workers, both asymptomatic and symptomatic. We have now added all first responders. That includes our firefighters, our law enforcement, and EMS, asymptomatic and symptomatic individuals. We're also inviting all symptomatic persons over age 65 to come and get tested, and anybody of any age with an underlying health condition who's symptomatic. So that would include people that have lung disease, have any cardiac disease, are immunosuppressed for any reason, taking immunosuppressive medications, are on chemotherapy, etc. So people in these groups for the drive-through testing at the Sonoma County Public Health Lab should call 707-565-4667. Again, 707-565-4667 to make an appointment with the county's drive-through testing. So other individuals who have coronavirus symptoms should still contact their medical providers to seek treatment and testing. So today, our community questions are, does the testing that is happening test for antibodies? No, the current testing that I've described today is not a serology or antibody test. Counties continue to work on the plans to offer the antibody testing, and we will let you know in the coming weeks who we're prioritizing for that testing. Another question, should I get a test even if I don't have coronavirus symptoms? I would say yes. Go ahead. Community-wide testing is a critical step towards reopening the county, and it'll allow us to know how much community spread we might have in the county. And it will include collecting a broad sample of results, including data from those who do not have symptoms. As we know that 1/3 of people potentially who have COVID don't have any symptoms or have minimal symptoms. So by all means, do call and get an appointment. Third and last question, when will we know the results of all this testing and how will it impact reopening the county? When aggregate results of both the county and state testing comes in, we'll be sure to share that with the public and discuss what that means for taking steps towards reopening. In the meantime, daily updates of the testing results and current COVID-19 cases are made available on SoCoEmergency.org. So thanks for joining. Take care of yourselves and your family, and we'll talk again tomorrow.